Yeah, hi, I'm Steve Morris, CEO of Arthritis SA, and my guest today is Dr. Madeleine Bryant. Hi,
Hi,
Madeleine.
Steve. Thanks so much for having me.
Yeah, and just to start off, maybe just give us a bit of a background about yourself.
Absolutely. I'm a qualified doctor, currently undertaking my specialty training to be a rheumatologist. So, I'm currently a rheumatology registrar and I work within SA Health in that capacity. I'm also studying for a master's degree at the University of Adelaide, and the topic of my study is looking at um, improving patient care in rheumatology.
Okay, thank you. I just want to go into a bit more detail about the research project that you're just embarking on.
Absolutely. So, the research that we're working on is looking specifically at how we can better capture patients' experiences of their care. So, what that means in simple terms is looking at how patients perceive their experience of coming to clinic, speaking with doctors and other health professionals, accessing, understanding, and taking their medications, and how overall that can impact their rheumatology diagnosis. So that might be their arthritis or their other autoimmune diseases. And we know that patients are really the best source of that information. They are the ones that can tell us the most about their experience of care. And we want to start doing that more routinely so that we can better design our clinics and our services to meet the needs of our patients.
Yeah, how do you kind of look at those things, Madeleine, in simple terms? What kind of measures do you use? What sort of questions do you ask?
So, if we were looking to capture information about a patient's disease status, so how well their disease is being controlled, we might look at more clinical information about their blood results or other tests and how their joints or other symptoms are being controlled in clinic. But to capture information about their experiences of care, really the way that we do this is by talking and asking questions. And in other parts of the world, and indeed in other specialties in medicine, this is done by using surveys or questionnaires, usually done at regular intervals. So, perhaps, for instance, every 6 months when a patient comes to clinic, and then looking at how that information that they're feeding back might change over time. And indeed, if that changes when we make changes to our clinics and how we give our services.
Yeah, have you found that patients are quite open in giving their feedback, either through survey or through interview?
Absolutely. So, patients are really engaged when it comes to matters of improving the care that they give, and it really stands to benefit everyone. If we can design our services better to perhaps pick up on those elements of care that we're not doing well, then we're going to have more satisfied patients and probably patients who are more engaged with the other parts of their care. So, overall, our aim is to get the best disease control and quality of life for our patients. And this is a really important element that perhaps we haven't paid enough attention to in the past. And we can provide the best medications and the best standards of clinical care. But if we're not doing that in a way that's accessible to our patients, then it's not very efficient. So that really is the driver for this project. So we're looking to take a survey that is used regularly, particularly in the United Kingdom and in other parts of Europe. And it's a fairly simple questionnaire that has around 30 questions, and it's given to patients regularly and asks questions about their access to care, their appointments, the way that they receive information, their understanding of their medications and their treatment plan, and overall if they feel heard and respected. And we're looking to make that appropriate for use in Australia. And our great hope is that we'll soon have a survey that we can use around Australia in a uniform fashion to collect that kind of information.
So this piece of research is kind of leading the way then in Australia as far as these kind of questions are based.
So, in a way, yes, this is novel research and it hasn't been done here in Australia before. Certainly in rheumatology, we don't have one go to survey or questionnaire that we can give to our patients to ask these kind of questions about their experiences of care. There's some behind the scenes work that we need to do, and that's what we're doing at the moment, making sure that the language in the survey makes sense to Australians, that it's familiar, and that it's picking up on the kinds of things that are important to Australian patients. We expect that that will be relatively similar to the important things to patients around the world in rheumatology, but we do need to do the work to make sure. And once we've done that, we hope to have at the end result a survey that we can make available to rheumatology clinics all around Australia in a very collaborative way to try and collect the same information around Australia from all of our patients.
That sounds fantastic, Madeleine. And are you still looking for participants now, do you have enough participants who've signed up?
Absolutely. So we can't do this kind of work without the assistance and collaboration of our patients. And we've been really fortunate to have some enthusiastic patients already come and do interviews with us in a one-on-one fashion to talk about the survey, whether it sounds Australian enough as it stands, and if it's capturing all the important parts of care for Australian patients. We're still recruiting for those patient interviews, so if any patients affiliated with Arthritis SA would like to get involved, that would be fantastic. The requirement at the moment is for a 45-minute one-on-one interview with myself, just to talk about the survey. And it's a really informal style of interview. There's no right or wrong answers. It's really a discussion about the survey as it currently stands and whether it can be improved. In the coming month, we'll be conducting 1 or 2 focus groups. So that will be where we meet together with a few patients at a time. And again, just bounce ideas around about some proposed changes to the survey, whether there's some new questions or changed questions that might be considered by patients. And then further into the future, we'll be looking to send the survey out in its final form and have patients answer it and see that it stands up to all the necessary tests that we need to do to get it through the checks and balances.
So one final important question, Madeleine. What happens when you've completed your project? What happens next?
So the end result that we're aiming for is to have a patient-reported experience measure, a PREM, that we can use for all rheumatology patients, regardless of their specific diagnosis, to ask them standardised questions about their care. Then we can take that data, the information we've gathered, and feed it back to the different clinics, either at a state level or either at a national level, and say, these are the areas that we could perform better. These are the things we're doing well. And these are possibly some changes to our clinics that we could make to better serve our patients.
Okay. Any final messages, Madeleine?
We'd love to have the involvement of any interested patients, so please don't hesitate to get in touch.
Yeah, look, and thank you. Thank you for your time. And look, this is a fantastic novel study for Australia, as Madeleine's outlined, and your enthusiasm kind of is pretty obvious, Madeleine, about how passionate you are about this area of improving patient care. So thank you and goodbye. And look,
Thanks so much, Steve.
thank you. And if you do want to take part, then if you just go to Arthritis SA website, you'll find details of Madeleine's study and how to get in touch. Okay, take care.
Thanks.